Hello and welcome to the Texas Neurological Society's podcast, Beyond the Brain. I am your host for this episode, Dr. Eddie Patton. I'm a former TNS president and current chair of the Medical Economics Committee of the Texas Neurological Society. And I welcome you to this episode on advocacy in action. And today I will be talking to Ethan Meltzer. And Ethan is a TNS board member and a member of the Texas delegation to Neurology on the Hill. He's an advocate, a strong advocate for neurology and his patients. And today we're going to talk about advocating to Congress and to the Senate. Neurology on the Hill is a advocacy day that's sponsored by the American Academy of Neurology, and we'll talk about some of the issues that were discussed at this year's Neurology on the Hill. But first, let me take a little time to introduce you to Dr. Meltzer. So, and is it okay if I call you Ethan?
Oh yeah.
All right, Ethan. So Ethan is a assistant professor of neurology at UT Austin Dale Medical School in Austin, Texas. He's a current board member of the Texas Neurological Society, and he serves on the legislative committee, and he's the current chair of the resident and medical student section of TNS. He's a well-published author and researcher and an industry expert in neuroimmunology and conditions such as NMO and multiple sclerosis. I mentioned earlier he's very passionate about his patients and neurology. And so, I'm excited to talk with him today about these pressing issues that are facing our field. So, welcome, Ethan, to Beyond the Brain.
Thank you for having me.
Absolutely. So, first and foremost, what really started you in advocacy when it comes to neurology?
Yeah, it's a good question, and I figured I would need to answer it on this podcast. And so I didn't have a lot of prior exposure during my time as a medical student or a resident, but then essentially shortly after finishing training, I think like a lot of us, I was sitting in clinic and I had gotten my feet underneath me and really had just started to experience, I think for the first time, a lot of the challenges that physicians and neurologists face with the practice of medicine and filling out prior authorizations and learning about step therapy and all these things. And I just thought, man, there has to be a better way. Mm-hmm. And so that was around the time that I got an email from the American Academy of Neurology and heard about this day of Neurology on the Hill and thought, why not me? Why not apply and see what happens? And so this was back in 2019, and that was essentially the very start of how I got involved in advocacy work.
Excellent. And when we think about advocacy work, and we're going to talk about Neurology on the Hill today and federal advocacy, but here in the state of Texas, this last legislative session, DPRIT was passed, which is a dementia, a large sum of money that goes into the research for Alzheimer's and dementia. So when you think about that and you think about your role in advocating for your patients, both nationally and so on the state level, have you had to kind of rethink how advocacy takes place and how to better use your tools as a neurologist and an advocate on both levels?
Yeah, I have learned a ton since 2019 about advocacy, both federal and state. And one of the things I learned, maybe somewhat of the irony, was through my work at the federal level, I quickly learned that Texas is really the envy of basically every other state in terms of organization at a state level of neurologists. And that's really when the Texas Neurological Society was pitched to me as this incredible organization, not just for advocacy, but everything else that it offers. And so I got involved at the state level after going to the federal level, meeting amazing people like yourself, Dr. Carlene Jackson, and realizing, oh my gosh, there's so much we can do in our own backyard and how quickly things move on the state level, that's kind of how I got involved with TNS.
Yeah. In agreement with what you're saying, a lot of people will be surprised that not all health care is legislated at a federal level. There are certain things like insurance and different things that are regulated on a state level. So, it's important to stay involved not only in D.C. with events like Neurology on the Hill, but also with local events. We do a TNS Advocacy Day in Austin at the Texas State Capitol, because there are some issues that are closer to home, near and dear to our hearts to get involved in.
Yeah, and I think a little bit of comparing the federal and the state level. The federal level, it really is a marathon, right? We might be talking about one issue hammering it home over years, and it does lead to breakthroughs and improvements in healthcare policy. At the state level, you go on that day, you might meet with 6 or 7 representatives in their office. You're shaking hands with everyone. You're talking about 7 different bills. And then we get the report. I'm sure you also got the same report from TNS. And it talks about, there's 10 pieces of legislation that passed in the last session that are all directly related to neurology, whether it's research or clinical care. And so it just goes so fast at the state level.
That's true. I remember going through that with the SGR fix, where year after year, we just, every year is like, man, we're talking about the same thing over and over, and then we got to fix. So things tend to work a lot slower at the federal level.
Yep, that's for sure.
So when you're advocating on the Hill, and you're talking with these senators, representatives from Congress and their staff, how important is it to communicate the direct impact of the ask? Meaning, you're going up there, you're asking for something, whether it be to co-sponsor a piece of legislation, but, how important are patient stories and really talking about your work locally in clinic?
Oh, it's the most important. And one thing I do, I've been very proud. I've gotten a lot of our trainees involved in Neurology on the Hill or at the state level. And a lot of them, I think at first think, oh, I don't have the experience to talk about this. And I say, no, every day when you see patients, that's the experience that they want. And so the example I would give is one of the things that we were advocating for at Neurology on the Hill, and I'm sure we'll talk about this a bit more in depth, was telehealth and the extension or permanent flexibilities to use it in this post-COVID era. And all of us just have these stories, right? As neurologists, we're seeing people who are coming from far away, because there aren't a lot of us. They often have disability. They rely on a caregiver to bring them in. And so when, for example, those flexibilities lapse for, I think it was the 47 days in fall of 2025, that has an immediate impact on so many people. And as physicians, it's really easy for us to say, hey, this was someone who, they can't get to my office. They're coming from an hour and away. They're disabled. They require assistance. They require their daughter to take off work. And the ability to see someone through telemedicine, that's a literal lifesaver. Yeah. And so that's really what we can bring to the Hill is we don't have to be experts in legislative policy, and I'm not. But what we're experts in is how is healthcare delivered, and particularly how is neurologic care delivered, and what are the acute challenges that constituents of that representative or senator, what are they facing, and why is this important to them? And that's something that any neurologist who sees patients is going to be an expert in.
Yeah. And I'll have to admit that years ago when we were first discussing telemedicine, I was one of those people who doubted it and said, we can't do this via telemedicine, and I need to lay hands on people and examine them. And now I do telemedicine every day, and it has become a vital part of practice. But that comes with realizing that we can reduce wait times and how effective we can be with telemedicine And now I'm a strong advocate for it continuing, and especially since COVID, where we were dependent on it, but now even after COVID, now that we've seen how important it can be, that we need to continue it. So along those lines, you talked about telemedicine. That was one of the issues that we discussed up in Neurology on the Hill. So what exactly was the ask with telemedicine?
Yeah, so when we go to Neurology on the Hill, the asks have different flavors. So sometimes it's associated with a specific bill. Sometimes it's more on the appropriation side, asking for money to be routed to a certain, for example, NIH. And so this one did have a bill. And so this was the Connect for Health Act. Mm-hmm. And there were bills both on the congressional side, in House of Representatives, in the Senate. And these are things that really have widespread bipartisan agreement. I actually checked it today to see what the most updated number was, and it's more than when we were there a few months ago. But on the House side, there's 233 co-sponsors, and on the Senate side, there's 73 co-sponsors. Right. And so I find these asks actually very rewarding. They aren't challenging because you can say, hey, this is something that impacts people living in Texas. This is something that Republicans, Democrats in Texas support. This can have an immediate benefit towards your constituents. What we're asking for is to put this on your radar, to really show why this is important, mm-hmm. and why they should care, why they should put their name onto something and support it. And you really get great buy-in from the staff and from the members.
Yeah, and specifically, I understand that even, after one of the visits we had, we were able to get someone to sign on. So what were some of the successes from that visit with telemedicine?
Yeah. As you said, I think in the state we had at least one. I think we might have even had more of folks who sign on, and a lot of it is just bringing it home, right? And it's talking about how Texas is one of these states, not unique, but has these challenges of just this huge geographic area, right? And where you have concentrations of neurologists or subspecialty neurologists like myself in major cities, mm-hmm. but there's a huge part of the population of Texas that is not just down the road from my clinic. And so these sorts of messages, I think when you tailor it to your locale and your state, I think they really do hit home with the members who, that's what they want to do, is they want to help people.
I couldn't agree more. And let's shift gears now and talk about another issue that we talked about up there, and that's something that we've both personally and as a society been trying to beat the drums on about for a while, and that's physician reimbursement, Medicare reimbursement, and what that means to healthcare. When we look at trying to attract people into the field and physician shortages, especially in neurology, where there is such a wide shortage of neurologists, which increases wait times that patients have to wait to go in to see a neurologist. Why has this issue been such a tough thing to get across, and what were some of the things that were discussed at this 2026 Neurology on the Hill?
Yeah, that's a tough question. I would say the short answer, why is it so tough? And the answer is money. Yeah. But really, why is this something I think that's really important to neurology, as well as some other specialties within medicine, is I always think about things through the lens of trainees, because that's a lot of what I do as a clinician educator. And the way that often I think about it is neurology and neuroscience is cool, right? There's not really a student. Now, they might be afraid of it. They might find it hard. Mm-hmm. But I think it's objectively, really, there's so many new treatments. It's really this last frontier of medicine. I don't think anyone would argue that neurology and neuroscience is an exciting field to go into. But when we talk about, okay, what percent of medical students go into neurology across the country, hopefully the number's a little bit better, but typically the number we quote is about 1 in 50. Mm. And so the vast majority of students these days aren't going into neurology. And I don't think it's because neurology itself isn't an exciting field, but you do have to think about other factors such as the economics of practice and what does a practice look like? Can you, for example, be a small business owner? If you want to focus on chronic care, how is that reimbursed if you're not doing procedures? Or what is the reimbursement for procedures? Or how does that change over time? And so when we think about things like the fee schedule, which I think can often be rather touchy subjects, really the framework I think about it is twofold. One is, how do we incentivize the next generation to go into neurology when all of us know the statistics of the growing burden of neurologic disease? Mm-hmm. So that's one. And then two is, from a business standpoint, how do we keep the lights on in practices? How do we prevent consolidation of practices? How do we pay staff to help support these patients in these really complex disease where we might be ordering medicines that require prior authorizations and infusions, and that's a lot of administrative burden that falls on a practice. And if, for example, the fee schedule doesn't increase with inflation, and the physician fee schedule is the only one that doesn't, hospitals do, hospice, ambulatory surgical centers, then what we're left with, and this is an example that I always hear from Dr. Sarah Austin, one of our fiercest and most passionate advocates, talks about how what she gets for reimbursement is basically the same as what she did, today compared to 25 years ago. Absolutely. When she first started in her practice. And so all of those have downstream ramifications in how, are people going to want to be neurologists? And then two, how do you run a business? How do you employ your staff? How do you provide that high quality care? And if you're not being reimbursed, then what it means is fewer neurologists. You have people leaving their solo practices. You have different cost models then have to come into play, and it's less access.
Mm-hmm. And that I call it the Medicare flatline. What you're talking to, there's a graph that shows that when you look at the physician fee schedule reimbursement, over time compared to other entities within healthcare, like the hospitals, a lot of things you mentioned earlier, they've been adjusting for healthcare, but the physician payment has stayed flat. And this isn't just a bunch of greedy physicians looking to get paid more to increase their lifestyle. I mean, this literally could be the difference between whether you can keep your lights on in your practice or pay your staff. Right. And if you close that practice, then guess what? Now there's more of a wait time for people to get into the next neurologist and so forth.
Yeah. And I know I'm still relatively young in terms of my practice years, but even in my short time here in Austin, I've already seen multiple physicians leave their solo practices or group practices, close or get bought out. And that's just within the past 8 or 9 years. Yeah. And we know that that's a nationwide trend.
Yeah. And so you may be asking, well, how does physician pay? How does that link to advocacy? Well, the largest payer is the government, Medicare, and Medicaid, but Medicare for that matter. So the reimbursement to physicians is linked to federal advocacy and things that are passed out of Congress and Senate. So talk to your representative, all those who are listening to this and watching this, and really advocate, because this is something we've been discussing for a while and there hasn't been much movement. But if we want to keep the workforce of neurology and healthcare as a whole viable over the next couple of years, make sure that we have plenty of neurologists and physicians to see everyone. This is a vital issue.
Yeah.
And then, one other thing that I know that you are, near and dear to your heart, because when I looked at your CV, I mean, you're well published and well researched and involved in a lot of research. But research funding, I mentioned earlier DPRIT, which was a specific Texas initiative that passed, but most research funding comes from the federal government. So when we talk about research, why is research funding so important and needed in neurology? And what was the ask of the Congress congressmen and women and the senators in D.C. this year?
Yeah. I think, as I said, neuroscience, it's the last frontier of medicine. We think about all of these diseases, and we have so many treatments now that we didn't 10 or 20 or 30 years ago. But how many other diseases here, Alzheimer's, Parkinson's, ALS, where we're really still lacking some really good treatments that prevent or stop disease or reverse disease. And as you said, Texas, I think, is really leading the charge at a state level with DPRID, and really that's modeled after all the success that CPRIT had, which I think was started in 2007. When we go to the federal level, each year, I do think that that's one of our three core asks tends to be along funding. This year, there was a particular focus on the BRAIN initiative. Mm-hmm. And this is where I learn a lot about how funds are appropriated and what's the difference between the NIH and the NINDS, and how are these pockets of funding created. And so the BRAIN initiative, the way that I would describe it is it's funding that is really looking at it, and this kind of started with the 21st Century Cures Act. And really the goal is to build the technologies that are going to cure these diseases. Mm-hmm. And so how do we develop the most cutting edge technologies to do things like deep sequencing of various genomics in the brain, or ways to turn on or turn off genes? These are things that we need if we're going to even have the requisite tools to really tackle some of these challenges. Mm-hmm. And so that's the BRAIN initiative has been something that's been wildly successful, but requires funding on an ongoing basis that comes from various parts of the government. And so the specific ask that we had this year is that a percentage of that funding was ramping down, and that was planned. Mm-hmm. And so what we were asking for is we were asking for Congress to appropriate funds, essentially to match the part that had been ramped down and had been sunsetting, to keep that momentum going. And so this is different a little bit than asks, for example, for the NIH budget or asks for the NINDS. And we have focused on that type of ask in the past. And so these are framed a little bit differently when we're meeting with members of Congress or their staffers. There's not a specific bill that you're asking mm-hmm. for, but this appropriations request, they're getting this from everybody. And so really what we're trying to do is trying to sell the importance of, okay, if you spend $1 on this, one, this is economic boost to the state. And it's something that Texas is leading the charge in with all of these academic institutions. Two, it spurns private industry. And so I think the number that we quote is often every $1 of federal funding generates $8 of industry spending. Yeah. And then three, just thinking about the future here, initiatives like the BRAIN initiative, this is what's going to be necessary if we want to say, hey, we have a cure for ALS down the line. It's likely going to come from these emerging technologies.
Yeah, and that's so important for people to understand, because medications don't just create themselves. They come through research, and and I may be dating myself. I'm probably a little bit older than you, but when I was in training, we really just had the ABCD for multiple sclerosis. We had essentially four yep. treatments outside of steroids and IVIG and that kind of thing. But now, fast forward, years later, I lose count of the number of medications that we have for MS. But because of that, people are doing better. They're living longer, and they're enjoying a better quality of life because we have better treatment options now.
Yep. And as you said, those treatments don't just come out of thin air. That comes from years of groundwork on the basic science side. And the funding from that, well, historically that's come from things like the BRAIN initiative.
Absolutely. Yeah. So in summary and closing, why don't you give us just some of your highlights, key takeaways from your experience this year at Neurology on the Hill?
Yeah. So I think the highlights could be broken down both in terms of the successes that we've had, so connecting with members of Congress or their staffs, getting folks to co-sponsor bills. And I've now been going since 2019, and that's a great feeling to see someone co-sponsor after you leave. There's also, and we didn't touch about this, these ongoing connections you then make with the offices. So I've met with my local staffers in the offices here in Austin after returning, and you develop these ongoing relationships where you're seen as an expert. And so if they have questions about other things that come up, hey, we want to be that, the AAN, the TNS, we want to be seen as the experts in the room who can offer that guidance. And then I would say selfishly, it's a way to really get engaged in the community. Yes. And so, as I mentioned at the beginning, that's really gotten me involved on the state level with TNS. It's connected me with folks like yourself, Eddie, where you really tap into a community of people who are seeing the same problems that you're seeing, and they want to do something about it.
Yeah.
And honestly, that's just a lot more fun than sitting in my clinic and bemoaning having to write a letter of an appeal. That's still not fun. But if I'm going every year and trying to do something about it, then I think it feels a lot more constructive.
Wow. Well, listen, Ethan, thank you so much for joining us today for this edition of Beyond the Brain, the podcast of the Texas Neurological Society. And I'm excited for you and your leadership within Texas Neurological Society, and also your advocacy efforts, because we talked about just a couple of things today, but there are so many issues and so many things that we need to continue to fight for on the front lines for both neurologists and our patients.
Yeah, thank you for having me.
Absolutely, and continue to tune in to future episodes of Beyond the Brain. If you enjoyed this episode, please like it and share it with your friends and colleagues. And look forward to seeing you for future episodes of Beyond the Brain.